advanced NSCLC treatment landscape. Over to Dr. Kumar, sir.
Hi, good evening, everyone, and thank you for introduction. So, my job is to introduce the topic, and topic for today has been this is a sponsor session by Eli Lilly, and they want to have a discussion on in first line setting in EGFR mutation where this stands. This is for me. My disclosure, yes, all the money, whatever you see, it goes to Tata Hospital. That I can tell you, all the trial or whatever ad board, nothing comes to me. So for Eli Lilly also, each and every penny goes to Tata Hospital. Having said that, a bit about the landscape for EGFR. This is where it all started. That is long back in 2003, when it appeared that this drug works, and there was an NEGM paper on based on 4 patients, and now you do have a lot many, almost 8 treatment options in the setting, 3 relatively older one, 5 newer one, and that's why we have all the discussion that where we will be using them. There is a talk about EGFR 19, same as EGFR 21, and by and large, we do agree that a different part of the world, the frequency is different, but by and large, they do have some different prognostic value. Exon 20 patients, they do bit better. Exon 21 patient, they do worse than exon 19 patient in lung cancer with EGFR mutation. So there is some merit that most likely they are a bit different. This also looks like when we see the drugs and the different drugs and their biochemical properties to see in what concentration they inhibit these different type of tumors that the cell lines with exon 19 and cell lines with exon 21, and it appears that exon 19 inhibition is far easier than exon 21, and this is for erlotinib, showing the same thing and the similar result that exon 19 is a bit easier to inhibit than exon 21, showing here that yes, exon 19 is a bit different from exon 21, and that's where the prognosis is a bit different, and maybe we need to talk about this more and more as the time goes by with the different treatment being available, and then we need to decipher which situation we will be using what. And with this, I hand back the mic to the organizers.
Thank you, Kumar, sir. Now, I would like to invite Dr. B.K. Smruti, madam. Madam is a very senior medical oncologist from Mumbai. She will be discussing relaying relay. Over to Dr. B.K. Smruti, madam.